Hi. Well, I'd like to go ahead and follow up with the last workshop we did. And if you remember at that, I asked you to think ahead to preparing something that will help you get in the right frame of mind for assessment and evaluation for the next presentation you have to give. So what I'd asked you to do is, first of all, to identify a presentation. Either think back to the last one you gave or think ahead to the next one that you're going to give, whichever is easier for you. And let's ponder these three things. And I'd like to ask you to actually write these down. First of all, can you identify objectives for your talk? It doesn't have to be a super long list. It can be bullets at this point. But do you have one or more objectives that you have for your talk? That's the first one. Secondly, can you write down a learning progression? Something that in your mind says, this is how I'm going to take you from this level of knowledge to this level, or from this ability to practice or this skill level to this one. So what are the progression that you have to work them through to get them from here to here? So can you write that down? And again, no magic number. That could be 2 or 3, it could be 4 or 5, could be 6 or 7. It sort of depends. But can you write down those levels? And then finally, can you identify 2 or 3 concepts in that learning progression that you would like to formatively assess? And then think about how you'd like to do that. So there are 3 things to write down. First of all, objectives. Secondly, the learning progression. And third, the formative evaluation that corresponds to some of those parts of the learning progression. The overriding question that you want to keep in mind is, how would you know that they get it? And how would you prove it? So what I'd like for you to do is to write this down, and you can either email it directly to me, or you can bring it to the next session and give it to Tova Sheldon, and she'll pass it along to me. So if you find it easier just to email it directly, you can do that. And this is something that I'll work directly with you, so you'll get feedback from me. Now on medical knowledge, you'll have me beat by a mile. But what I hope to be able to do is just think about that last set of questions. How do you know and how do you prove it? And I'll just kind of be looking at that and give you some feedback on your objectives, your learning progression, and your formative assessment. Now, if you don't have any ideas, if they're especially on the formative assessment, you can just say, I'd like to assess this here, but I'm not sure how. And then I'll try to help you out with an idea or two. Sometimes I give really good ideas and people like them. Sometimes I give really dumb ideas and people say, wow, that's really dumb. I can think of something better, and it inspires them to do that. However we get there, we'll get there. So if you can do that, then I'll work with you. That's all.